Nakaseke General Hospital, located 66 kilometers north of Kampala, is a government facility built in the 1960s under Prime Minister Dr. Apollo Milton Obote's administration. Serving over 360,000 people, the hospital is struggling to provide adequate health care due to a range of operational challenges. According to Dr. Bernard Okongo, the hospital's medical superintendent, frequent power surges are severely affecting critical services, including diagnostic procedures.
Once in a while, we get a big upsurge of power. And when this power comes in very high upsurge, it destroys and shuts down. A number of our equipments, including even my computer I use in my office, had to be destroyed. The television sets, incubators, warmers for the newborn babies, and a number of other equipment. So it's a big challenge for us. So we have to provide now a UVS for all these equipment to make sure they are protected. Just recently, our laboratory, we were buying bulbs for the microscopes every week. Now, in terms of the water supply for the hospital, we have a dedicated water pump, but it is run by electricity also. Now, two things. One, we have load shedding. Sometimes we go 2 days without power, or sometimes 3, 4, and at worst we have gone for a week or so.
The breakdown of equipment has led to numerous referrals, even for minor procedures, further straining the system. Despite having a vacant biomedical engineer position, the hospital has not filled the role, worsening the situation.
According to the new structure of the Ministry of Health, which is not yet implemented, it's just implemented, we are just starting to implement it bit by bit, that position is there. Actually, when a few weeks back I told my boss, the DHO, that this is one of the first positions we need to be allowed.
The hospital cares for 60,000 patients annually, with 8,000 admitted from surrounding districts like Wakiso, Nakasongola and Luwero. Every year, they deliver 4,400 mothers, 1,200 of whom require C-sections. However, the loss of vital equipment, such as 7 incubators, due to power surges, has critically impacted maternal and neonatal care.
We are talking of machines, for example, for diagnosis, laboratory machines. The clinicians, the doctors cannot make a diagnosis, proper diagnosis minus the laboratory results. Even if you have malaria, you need the malaria test for, use a microscope. So even this other machine, so the impact is so big and negative. When we don't have one machine is not functional, then a patient who's very sick, how would you refer that patient to a different unit? Is already sick. A number of them don't even have the resources to transport themselves, and it's very inconveniencing. Because now, if a machine broke down, for example, the one for sterilization, and we cannot do the operations from here, we can't do the scissors, and it happens, I think, sometime back, maybe once or so. Then these patients, to be done scissors, have to be referred to the nearby hospital, which costs money, time, and even endangers them, because some of them are emergency operations. So the breakdown of equipment is extremely critical to the hospital. That's why I think we need to have 2 equipments, a standby one and one which functions, that if this one breaks down, we can use another optional one to keep the services going.
In 2013, the government contracted Yanjian Uganda Company Limited to renovate hospitals, including Nakaseke, at a cost of $5 million, about 18 billion Uganda shillings. However, some structures remain incomplete.
The Right Honorable Robin Nabanja was here with us on 21st of March this year. And she also, even before we mentioned anything about, she said, no, this hospital needs some renovation. So we have written to her so that she can voice that issue, so that we can see how the hospital is renovated. Not just the hospital working areas, but even the staff quarters, because we also have the staff quarters which were only partially renovated in the project, but other blocks were not renovated. So,
despite the challenges, the hospital benefits from partnerships like Engineers Without Borders, who have helped repair several pieces of equipment.
We facilitate increased capacity building, capacities of the technicians, capacities of the local engineers to be able to attend and support the infrastructure within the healthcare facilities. We think also that we will see more resilient communities, more resilient healthcare facilities.
When EWH was started over 20 years ago, the world was a very different place. We weren't a global world. We weren't connected through smartphones and the internet. It wasn't as pervasive as it is now. The concept of doing a semester abroad was actually fairly new. The programs, universities didn't have global programs. And the understanding of global health needs was really very new. And so Engineering World Health really answered those needs. It provided students an opportunity to look beyond their narrow world of university and become global citizens and see real needs such as meeting community health needs in other countries.
Dr. Diana Twine, Permanent Secretary at the Ministry of Health, acknowledges the funding shortages affecting government health facilities.
It is not only Nakaseke alone. Quite a number of our hospitals are affected. Actually, our equipment has been burnt. Even when we use stabilizer, I don't know how, but so this is a bigger problem we are discussing with the Ministry of Energy and UMEME to address. So right now, it is the resources that are limiting. We know these challenges, by the way.
While efforts are underway to train more biomedical engineers in partnership with Kyambogo University.
This started way back in 2006, where the Ministry of Health approached Kyambogo University for us to start a biomedical engineering training program. Since that time, we started a partnership to do capacity building together with Kyambogo University. As I speak right now, we have over 300 biomedical engineering technicians produced under this arrangement.
With limited resources and ongoing power challenges, Nakaseke General Hospital remains in dire need of comprehensive support to continue providing essential healthcare to its growing population. Walter Mwesigye, NTV.